Okay. Oh my God,
Let's get that wine in.
Come smell this. Oh.
Okay, that's the gram-negative face. All right. People always ask what it smells like. Well, that face is pretty much the best I can decide. All right. In a perfect world, we should have cultured this last week to know exactly what's going on, but there it turns out that our eye nucleation has abscess. And it was an abscess to begin with, so it looks like he was doing fine for the first few days, but now exactly a week later, it has ruptured, and now that whole pocket is done. Okay. Let's go back to some different antibiotics. Have to guess all over again. All right. Okay, here's our cute guinea pig from last week. Actually, the surgery went well. I just finished showing the clients the video, and it actually looks like a really good job. Unfortunately, we took some shortcuts, and this is the price we pay for taking some shortcuts. In a perfect world, we would have cultured that organism, and by, let's say, probably actually by yesterday or the day before, we would have had those results back from the lab, telling us exactly what species of bacteria it was, which may have told us where he got it from, and exactly what antibiotics would have killed it. And of course, had we noticed that none of those antibiotics were the ones that we had sent home with, we'd given you a phone call immediately, and then probably the day, as Monday or Tuesday, we would have actually had them on the right antibiotics, which could have prevented this. Anyway, just now, we ended up cleaning up this lesion, and the whole suture line pretty much came out in a scab, and there's another abscess beneath it. And if you look really, really closely, you can see that little tan pale area. That is some of the necrotic tissue beneath there. But because that is an eye socket and it is open up, close to the brain, we got to close that as quickly as possible and then treat the scar tissue as best we can. So we put in a local block, which our buddy here thought was more painful than the staples themselves. Did you hear him whining? He wasn't screaming for the staples. He was screaming for the local block.
Oh, wow.
And then put in some staples. So it is now closed again. So, it turns out that we make our decisions when it comes to medical treatment for 1,000 different reasons. Economics is always one of those. But whenever a doctor recommends a culture, it usually is for a reason. Mm-hmm. That probably would have prevented this process here. At least as soon as I had seen the name of the bacteria. We've cleaned it up again. We've flushed it as best we could with some Chlorhex and a tiny bit of peroxide. Did a local block, put in some staples, and that's what it looks like as of today. So anyway, the medicine is what it is. They call it practice for a reason, and this is just one of those lessons that we've all just learned again together. Mm-hmm.
Yep. Wasn't for the government shutdown, we would have got the culture.
Oh, there you go. So, and then we'll talk about closed borders in a second. Well, anyway, So we'll keep that off this video because politics is not my forte.
Me neither.
Anyway, so that's what it looks like for today. So far, so good. We'll change to go to a different antibiotic, and hopefully this will make all the difference in the world. Okay. Wait, goodbye. Oh, you can't see me. Sorry. And I was going to give this guy a sexy eye patch today because people keep asking me for eye patches for these guys that lose an eye. But I think the stainless steel is sexier, so I'm leaving it just like that. And Dad said he did this when the daughter asked. So.
That's right.
So I'm off the hook for a while. All right, later.